I believe that every person should have access to affordable, quality healthcare. And unfortunately, our current healthcare system doesn't meet that goal. And individuals and families across this country continue to be impacted by the rising cost of premiums and copays. And the price of prescription drugs adds to our healthcare challenges because there are so many Americans who face the choice of either buying their medications or putting food on the table. I do not believe that we should go back to the days when high-priced insurance companies could deny coverage for people with pre-existing conditions or drop someone when they get sick. And I personally want to work with anyone from either party who wants to have the goals of reducing premiums, out-of-pocket costs, and prescription drug prices so that healthcare can become and remain more affordable. I also believe that we as a country need to do more to invest in preventative medicine, and as a community educate our citizens on healthy lifestyle options and patient choices and responsibilities so that people are prioritizing preventative health care and early interventions, and ultimately helping to lower the rates of chronic disease, which currently account for about 86% of healthcare costs across the country. To this end, to achieve this, I support strengthening and building upon the structure of the ACA. There are some common sense reforms before Congress right now that could actually dramatically strengthen our current system. One would be to align healthcare open enrollment with tax season. The current timing of open enrollment overlaps with the holiday season, and it's when families tend to be stressed and busy and distracted, and so it could have the result of limiting the number of people who actually sign up for care. So shifting, the mere administrative change of shifting the date to align with the rest of our administrative tasks like filing our taxes would allow for people to have the most up-to-date financial information available when they're filing for coverage. And in conjunction with making common sense reforms to the ACA, I support pursuing universal coverage through the creation of a public option. And on the Senate side, Senator Kaine has proposed the Medicare X public option program. And if enacted, it would give more coverage choices to consumers and put downward pressure on the prices and ultimately lower the price of coverage for Americans, regardless of whether they have an employer-provided plan, a marketplace plan, or are using Medicare X. And in addition, I believe that Medicare should be able to negotiate its drug prices with pharmaceutical companies to help lower the high cost of prescription drug prices that many of our seniors are facing. And now that Virginia has expanded Medicaid, it is incredibly important that the federal government follow through its part of the bargain. And in doing so, I oppose any measure that would shift the cost of expansion to states. Expansion is going to be a powerful tool to help our rural hospitals stay afloat and bring access to thousands of people across the Commonwealth. And as a Virginian, I appreciate that Medicaid expansion has actually allowed the Commonwealth to invest additional dollars in critical education efforts.